an incredible range of medical imaging services here at Whitehorse General Hospital. Obviously, we've got X-ray and CT, mammography and ultrasound capabilities, and we're really excited to be bringing MRI on. We also have an incredible team of highly skilled and specialized staff who run all of this specialized equipment and provide round-the-clock dedicated care to our patients. We're very, very fortunate with our small size, relatively small hospital to be able to have this very robust imaging department. Thanks to the community, in particular the Yukon Hospital Foundation and Run for Mum, we've been very fortunate recipients of some substantial imaging equipment, which is now one of the reasons why we are 100% filmless and we're a digital state-of-the-art imaging department. Having these very important tests here closer to home, it saves our patients from having to travel out for sometimes critical tests, but often just general routine follow-up tests that they need. And it allows us to improve the patient experience by having these tests closer to home. Watson and Dawson both have the ability to provide X-ray services in those hospitals. Whitehorse General provides support to those hospitals, but they do have combined lab X-ray techs and nurses and physicians that provide the critical urgent X-rays that are needed in those communities. And that saves patients having to come to the primary imaging center, which is WGH, for those tests. So when a patient arrives in the medical imaging department, they can expect it to be greeted by our very friendly and knowledgeable staff. Depending on the type of test that they're having, they may have to change their clothes, obviously, for the test. We'll bring them back into our change room. They'll get changed in privacy, and then we'll bring them into the imaging room. Again, depending on which exam they're having, they'll receive their treatment and their test by a certified technologist in whichever area, whether it's X-ray, CT, ultrasound, or mammography. They'll be instructed on what to do for that test. Once the test is completed, then they'll be informed of what they can expect for follow-up. What happens after a test is completed is the images are sent digitally to our radiologist, and the radiologist is a physician who's specialized in interpreting imaging exams. Once the radiologist has completed reviewing those images, then a report is sent to the ordering physician of that exam, and the patient gets those results from their physician on their next follow-up. So often if the technologist senses that there is a patient who's a bit apprehensive, whether it's the first time they've had this test or for whatever reason, the technologists are trained on how to coach the patient through the examination. We won't do any imaging procedure until we've received consent from the patient. So often that is a verbal conversation between the technologist and the patient. The technologist explains thoroughly to the patient what needs to happen, what they need to do. The patient is given the opportunity to ask any questions. We want to make sure that the patients are very comfortable. They know why they're there. They know what's expected of them. When we work really well together and have good communication between the technologist and the patient, ultimately that improves their patient care because it enables us to get the best image quality we possibly can for that exam.